Alright, so we're going to take a look at the muscles of this model. Let's start here in this region of the face. We've got masseter right through here, coming up to the zygomatic arch. We also see zygomaticus major and a hint of zygomaticus minor. Looking at a deep view, coming in here from mastoid process, connecting on down towards the mandible, we're going to see here the posterior belly of the digastric muscle, here the stylohyoid muscle, and here the styloglossus muscle. On either side of the neck, we're going to see sternocleidomastoid right here. And then headed down towards the first rib, this is anterior scalene on either side. And then you see a little circle of muscle which appears to be running in the transverse plane. This is actually the inferior belly of the omohyoid muscle. So that's heading from here, and then it's going to angle up. The superior belly of omohyoid is what's going to insert onto the hyoid bone. As we get down here, we can see ribs. Right? And then as we go superficial to deep, we're going to have a few different layers of muscle. So pectoralis major is this thick, most superficial muscle. Right underneath it, pectoralis minor. Deep to that, serratus anterior, which is going to come all the way down to about here, at which point this layer would then be representing the external abdominal obliques, or just external obliques. Below the ribs, we're going to have internal obliques as this kind of middle layer of muscle, and then transversus abdominis, the deepest layer. And we can see transversus abdominis here as well, this little transverse running white section. Going back up to the ribs, we've got intercostal muscles, right? And based on where we are, there's most likely going to be both layers of intercostal muscle present. So we would have external intercostal and then internal intercostal deeper, closer to the lung. Looking down into the abdominal cavity now, we can see diaphragm. So diaphragm is all of this through here. And we can see some of the hiatuses of the diaphragm. So here's the esophageal hiatus and the aortic hiatus right there. That's where there's actually a space in the diaphragm through which these major tube structures run. As we work our way down, this white line on either side is the iliac crest. So that's the superior surface of the ilium. Wedged underneath this kidney is one of the quadratus lumborum muscles. And then underneath this kidney is the other quadratus lumborum. In front of or anterior to the ilium, right, taking up that iliac fossa, is the iliacus muscle. And then coming down from the lumbar vertebrae, exiting out with iliacus, is the psoas major muscle on either side. So a left and a right. Iliacus and psoas major are going to converge with each other at the inguinal canal, and when they enter the thigh, we'll just call them the Iliopsoas. Or you can pronounce it Iliopsoas if it helps you remember there is a P in psoas.